Okay, thank you. So, good evening, everyone. A warm welcome to each and every one of you who have joined together for another episode of the Upper Crest. We are extremely happy to welcome you on this forum, which we call the Upper Crest, our initiative to upgrade the dentist fraternity in India on the latest and the best which is happening all across the globe. We in Inkemi have been working very closely with Dr. Ajay Kakar, who happens to be the founding member and the brain behind the Upper Crest. So thank you so much, sir, for taking this unique
Welcome.
initiative for doctors in India and abroad. Today, it's also a proud privilege to welcome Dr. Minas Leventis all the way from Europe. He'll be joining us. He has already joined us. I'm so sorry for that. And he will be deliberating today on a wonderful subject. I mean, that's going to be very enriching and very new for the Indian audience. A warm welcome to all of you, sir.
Thank you very much.
Doctors, it's our 8th session on the Upper Crest, and we have a lot more coming in every Sunday. Inkemi has been working very closely with the dental fraternity in India to bring the latest and the best which is happening all across. Now, without much ado, I'd like to hand over the session to Dr. Ajay Kakar, who will introduce Dr. Leventis, and then Dr. Leventis takes it forward from there. So over to you, sir.
Hello, everybody. This is Dr. Ajay Kakkar here. It's my proud privilege today to welcome my very close friend, Dr. Minas Leventis, who is from London. He is originally from Greece, but he practices in London right now. He's done his DDS from Greece, then he's gone and done his MSc in clinical oral surgery, and he has also done so many other degrees, and he has been practicing in London for so many years. He has been invited to lecture all over. He lectures almost all over the world, constantly lecturing here, there, everywhere. And one of the brilliant aspects of Minas is an absolute expert. I would not be shy to say that he will have at least 1,000 cases done on this material called Blue M gel. Blue M gel is a fantastic material. I will leave Minas to talk about it to everybody. So over to Minas.
Thank you, my friend. Thank you very much. Thanks for organizing this wonderful event. And thank you very much for your kind words. I will try to share my screen.
Please do that. Yes.
We are good?
Yes, please full screen. Presentation mode.
Okay. Can you see my first slide?
Yes, we can see your first slide, but it is not in presentation mode. Can you go into presentation mode?
Okay, because...
Yeah, there. There you are.
Okay, thank you very much. So today for the next hour, we're going to talk about oxygen, about Blue M, topical oxygen therapy, and we are going to see some scientific data and some very interesting clinical protocols, how we can use these agents to control the bacteria and to accelerate the healing in dentistry, surgery, prosthetics, whatever we are doing every day.
Minas?
Yes?
Your screen was coming and it just came up and then we again lost it.
You don't see now my screen?
No, we see the screen, but only the first slide. We don't see the second slide.
Now you don't see the second slide?
No.
Okay, let me do it again.
Yeah, now we see the second slide, but it is in regular mode. It is not in presentation mode.
Now?
Still in the regular mode, not in presentation mode. I don't know why.
Okay, I don't know why either.
Can you start it again?
Let me start again.
Yes, please.
Because shouldn't happen. Okay, let's fix it. Okay, let me try this one.
No.
Nothing?
No, nothing.
Nothing, okay. Okay, so PowerPoint, sir.
Yes.
Better?
It is better. Your screen is there, but it's not in presentation mode, but doesn't matter. Nishant, what do you see? Okay, continue. Minas, continue. Please.
It should be. Let me store, sir. Let me. Because...
So it was in the regular mode only. You can make it in the presentation mode.
Okay, let me do it once more. to be sure that everything will be good. Okay, share PowerPoint.
It doesn't.
No, sir, it just came back and went back again. So you can do it slowly. Just tap it once, sir.
Because now I'm in presenter mode and
No, sir, it's still in the regular mode. You can skip it and then maybe try it once again.
okay. All right. Okay, so I will go entire screen. So now
Yes.
you see my desktop.
No, not the desktop. In
What?
this, yes, perfect.
Okay,
Perfect.
bingo.
Sorry, everybody, for the small glitch, but now we are all fine. Minas,
we're-
continue now.
Thank you very much. Sorry about this. So that's me. Thank you, AJ, for your introduction, your very kind words. I'm an oral surgeon. I have a PhD in oral surgery, and half of my job is to do publications, research, traveling, webinars like today. So we try to publish everything. Whatever I will try to show and explain to you today is already published. We are planning to do also many more publications. And my job, my work is focused mainly on bone regeneration, surgery, implants, and topical oxygen therapy. We have a lovely scientific board for BlueM. I'm the president of the scientific board. AJ is a close friend and is one valuable member of this board. And what we try to do is we try to do as much research and development on those products to help all the clinicians globally to improve their daily work. You can check the screen. You can follow us on social media, on Facebook, on Instagram. We have very active Facebook groups where we interact, we publish our cases, and you can find whatever I will tell you today and much more there. We'll talk about dentistry, although I'm an oral surgeon and implantologist, but today we are going to talk in general about our science. It's an amazing science. Now technology gives us the opportunity to have great, amazing tools to do excellent work. Let's say just in implantology, we have new bone grafts, we have digital scans, intraoral, extraoral. We have amazing CBCTs, precise surgical guides, implant systems. So we can do whatever we want. Too many tools, too many opportunities. But of course, always we need to learn the basics. We need to respect the basics because without the important fundamentals of biology, of surgery, and what we'll say today about the controlling of bacteria, if we miss this, we're going to have problems. So bacteria is something so important, whatever we do in dentistry. Just in implantology, the biofilms, the pathogenic bacteria, they give us huge problems. We see them every day with a pandemic of perimplantitis. So we have infections, we have bone loss, we have inflammation, and we try to fix those problems. And sometimes it's really, really difficult to manage them. And a big issue in dentistry and in science is that just to diagnose something doesn't explain things. I get my probe, I check the pockets, I see the swelling, the pus, I see my bone loss radiologically, but it is a diagnosis. It can trigger more action to fix this, but the diagnosis doesn't constitute an explanation. So to prevent this and to understand why we have all those problems with bacteria, what we need to do, we need to understand more, to have a clear understanding and clear vision of how everything works in dentistry. So we need to see all the aspects as parts of a system because the body, the mouth, the teeth, everything are systems. So we are talking about parts, about elements, important components that they are all, how to say, interconnected, interacting, and interdependent. So the biofilms, the bacteria, are not just alone in the mouth and in the body, but they are very important parts of the system of the mouth, the teeth, and the implants. So we need to see this as a system, and that is going to help us explain more what is happening and to find very good solutions. How we control bacteria? In dentistry, the gold standard is chlorhexidine. We use extensively chlorhexidine as an antibacterial agent to disinfect, to clean the surfaces, to manage infections and inflammation. But it has many problems. We know, of course, the well-known reversible problems of chlorhexidine. It is associated with staining of the teeth, staining of the tongue. It's changing the taste. It can give to the patients a burning sensation. Also, if we use chlorhexidine inside fresh wounds and the patient is allergic, it can trigger anaphylactic reactions. We know all this, and of course, these are important factors we need to consider, and they limit the use of chlorhexidine. We know we can use it just for a few days. But science is progressing, and we see now that year by year we have lots of research, we have scientific evidence which is showing what we have seen decades now clinically, that we have also toxic effects. So when we use chlorhexidine, even in small amounts every day, this might have a cytotoxic effect, and it can damage the cells that we need for healing. So you can see all these papers, and there are more papers, and they describe how chlorhexidine can damage, can affect negatively the fibroblasts, the osteoblasts, the keratinocytes, the gingiva cells. So this is something important because we need to use agents that they promote healing, they are not toxic. And another important thing is that we use chlorhexidine to control the bacteria, to kill the bacteria, but it is very aggressive. It is a very aggressive antibacterial agent, and that means that it can damage the normal flora of the mouth. It can damage extensively the microbiome that we needed. So what is happening is we see now through very good papers, this is published in scientific reports. There are also other new papers that they describe exactly how chlorhexidine is damaging the good bacteria of the mouth, and those nitrate reducing bacteria, that's how they call them, they are important to regulate cardiovascular system and blood pressure. So we see that using extensively chlorhexidine, it can have problems in the body, and most importantly, it can be toxic for the cells, and it can alter, it can damage the normal bacteria of the mouth. So we are progressing, and we try to find better solutions. What I use personally the last 10 years is topical oxygen therapy. I'm using Blue-M to control bacteria and accelerate the healing. And this is a notion, this is a philosophy, some products that first were developed by Peter Blythrop. He passed away a few years ago. He was an amazing surgeon. He was a visionary, and his mission was to do the best for the patients, to find the best solutions and the best treatment modalities to help the healing. So that's how they started, and they created Blue-M. And how it works, it's something completely different to the gold standard of chlorhexidine. It is working with oxygen and lactoferrin. So these are the two main tools, ingredients of Blue-M. And we use oxygen and lactoferrin to control the bacteria, to manage only the pathogenic bacteria, so we don't affect the good flora of the mouth. Also, to promote, to accelerate the healing, and to improve all the treatment steps. Because it's using oxygen and the lactoferrin, So what is happening is through sodium perborate, it is releasing a safe, stable, low quantity of oxygen. This releases up to 15-20 minutes. And also it's releasing lactoferrin, xylitol, methylsalicylate, and some other factors that have also anti-inflammatory effects. I will not go deeper into this, but this is in general how it's working. So we apply the BlueM gel and it's releasing a small safe amount of oxygen. We know now from medicine that we need oxygen for healing. Oxygen has a crucial role in soft and hard tissue healing because this molecule is involved in all the healing stages, in all the processes of healing. When we create any wound in dentistry, it means that the cells will need oxygen. They have a high oxygen demand, and we see, especially in people who have difficult healing, in smokers, in diabetics, that if we have hypoxia, this is associated with pain, we have slow healing, we have bad healing. So oxygen is important. When we send oxygen to the cells, the fibroblasts produce more collagen, the keratinocytes produce better epithelium, the necrotic tissue is degraded, and oxygen also creates a hostile environment for the anaerobic bacteria. This is the framework of oxygen, and at the same time, as I told you, BlueM gel is releasing lactoferrin. So in parallel, lactoferrin is accelerating the healing of the soft tissues. We know from dermatology that if we apply lactoferrin, we have better granulation tissue, we have better epithelium, but also we know from surgery that if we apply lactoferrin and we mix lactoferrin with bone grafts, then lactoferrin significantly, it helps the bone regeneration and it's giving us better hard tissues. So that's the combination. If you see this table here, you can see the differences. On the right hand, we have chlorhexidine, the gold standard, but we see that it is a very potent, it's a very aggressive broad spectrum antiseptic. It has no direct regenerative effect. It is toxic. It can be toxic for the cells because it's a very aggressive material, and we can use it only for a few days. On the other hand, using BlueM, we have only benefits. It is against only the pathogenic bacteria. We see that it doesn't harm the good bacteria, and in parallel, at the same time, actively, it is supporting the healing of the soft and the hard tissues. And because it has zero side effects, it's safe to use it for as long as we need it. And we have now very good studies. We have clinical studies and experimental studies that they describe all this. They compare also BlueM to chlorhexidine, and all this analysis of the science we have now, they clearly show to us and they support our claims how BlueM inhibits pathogenic bacteria. It modulates this virulence gene expression of the pathogenic bacteria, and overall it is creating a safer, less toxic environment for the cells. But of course, we need to translate all this and apply all this to clinical practice, because that's what we are doing every day. And in clinical practice, whatever we do in dentistry, we do root canal treatments, prosthetics, extractions, implants, perio. We are hygienists. Whatever we are doing, we need to control the bacteria. And the first means, the most important way to remove bacteria and to control them is by mechanical debridement. So we have our tools, or our toothbrush, or files, or perio instruments, or surgical instruments, and with all these mechanical tools, we remove the bacteria. So that's the first thing we need to do. Let's say for extractions, we know very well that if we don't debride the site, if we don't remove all the infected soft tissues mechanically with our bone curettes, then the area is not going to heal because we leave behind bacteria and inflamed soft tissues. So when we remove teeth, because we want to eradicate the pathology and we want to rehabilitate the area with an implant, the first skill we need to develop, the first thing we need to do is an atraumatic extraction. So we need to remove the tooth without damaging the soft tissues and the surrounding, or in the middle, the hard tissues. But it's not just to remove the tooth atraumatically. The most important part is to remove all this pathology. So first of all, we need to see what we are doing. So it looks clean after removing the tooth, but under the septal bone that I managed to preserve, there is a big cyst. So I need to take my light, I need to take my suction, my small instruments, and thoroughly clean all the soft tissues. And you see now in this picture how clean now the bone looks all the way down in the socket under this septal bone because I removed all the cyst. Now what happens? If I leave these soft tissues, so if I leave it like that, and I place in here a bone graft, or I place in the middle my implant, it's very possible that the bacteria of the soft tissues will proliferate and they will give me problems. So that's why we need to be so careful in any type of small or bigger surgery we are doing, not just to remove the teeth, but take our hand instruments. There are also in the market very nice degranulation burrs, and all this soft tissue that is filled with bacteria has to go away. And at the end, to have an area, to have the bone defect, which is completely clean and debrided from all bacteria or all the soft tissues. So the first stage is mechanically to remove the bacteria. And when we finish this, then we need to use our chemical agents to disinfect the soft tissues and the hard tissues. So for my extractions, if it is a small, straightforward extraction, or if it is a more challenging, a bigger surgery that I removed a cyst, impacted teeth, this tooth here, again, first I clean the bone mechanically, and then I take my Blue-M gel, as you can see here, and I apply it for 5 minutes inside the bone defect. So I place the gel for 5 minutes, I place over a gauze, and I wait. I tell the patient to bite the gauze. During this time, I'm doing something else. I'm cleaning my instruments. I'm preparing for the next stages. So you can see here, immediately when we place the gel, you see all these little bubbles. It's releasing the oxygen and the lactoferrin. So this is going to stay here for 5 minutes. And after 5 minutes, I rinse it and I remove the gel with my suction. And then we can do the implants, the bone grafting, whatever is the next step. You see here, when I finish the extraction, and for several days, I place the gel immediately post-op, and I give the gel to the patient. So what I tell the patient is not to brush the area. I don't want to go here with the toothbrush and damage my stitches or my graft, but instead, I give them the gel and I tell them, you will apply the gel 3 times a day. You will rub it on the stitches, on the soft tissues, and you will leave it for at least 10-15 minutes. And then you can gently rinse the mouth, or even if the gel will dissolve in the mouth, it's absolutely safe. These are the clinical protocols. I will show to you many ideas and explain why we do this with the Blue-M gel. Another very important topic is the stitches. So we place sutures for many reasons when we do our surgeries. And we know from surgery that the bacteria that will accumulate on these stitches are the most important reason why we get postoperative wound infection. So what we need to do is as you can see here, we need to use very thin monofilament, high quality stitches. So as they look clean here, this is how we need to keep them. But what is happening many times is that you see, we have all this biofilm which is accumulating on the surface of the suture. And what is going to happen is that the bacteria, they will not just stay here, but through the suture line, they will go inside the soft tissues. And when the bacteria will go inside the soft tissues, they will get more anaerobic, and this area here will get infected. This is why the sutures and the bacteria that they colonize the sutures, they give us postoperative wound infections. And in our job, a postoperative infection might mean a wound dehiscence. It might mean that we might lose the bone graft or the implant might have problems. So we need to be very careful. And what I'm doing is that I apply on the stitches the Blue-M gel, and the patient, for as many days as the stitches are in the mouth, will be applying the gel 3 times a day. And you see here how the gel is releasing the bubbles. It's meaning it's releasing the oxygen and the lactoferrin, and this will keep the stitches very clean and is going to help the healing of the soft tissues. This is the logic, and it is very effective. So always on the margins of the wound, on the stitches, we apply the gel. And if you do it, if you make this your protocol and you include this action, this treatment with the gel, if you make it a habit, you will see after 6-7 days, all your cases, how they will look much better, how the stitches will be clean, and how the patient will feel better. You will have less inflammation, less problems, better healing. Look this case here that I did an apicectomy. So I want to avoid a scar formation. And of course, I want to avoid the postoperative infection, because if this will get infected, it might open and I might have problems. So what I'm doing here, I'm placing very thin monofilament stitches, and immediately on the stitches, I apply the gel. You can see the gel on the area and all the little bubbles that are released. We do this every day, and you see after a week, it's not red, it's not swollen, it's not infected, it's not inflamed. We have a very good healing. We remove after a week the sutures, and now we will keep applying the gel, because we want the gel to get in this line here and help the fibroblasts and the keratinocytes to accelerate the healing. And you see after 7 months and after 4 years, how we use the gel after the surgery, and it can give us in the long term excellent healing, no scar, and very good results. These concepts, we can use them to make our work better and safer in whatever we are doing in dentistry. In this case, I did a GBR, and you can see after a few days, this is after a week, because of tension in the area, maybe because of some pressure from the provisional denture, we can see here this situation. So what we see here is that the line of where I suture the flap is a bit open. It's not infected, but I have here secondary intention healing. So what I want to be sure is that this area now will be free of bacteria. It will not get infected. And at the same time, I will speed up the healing. So that's why I apply the gel. And what I'm doing is I give the gel to the patient. He has a denture here, a provisional denture, before doing the implants. And I tell him, you will place the gel 3 times a day in the denture, and that's how you will fit the denture. And you will use it for as many days as we need it, because it has 0 side effects. And you can see here, after a few weeks later, that the healing is perfect, because we control the bacteria and because we accelerated the soft tissue healing using the Blue-M gel. In any case, we have a kind of very small or bigger soft tissue healing. Let's say in cases that we do extractions, we do a GBR, we do a bone grafting, and we have a kind of open healing, because in many cases, we don't want to stretch the tissues, we don't have to make a flap, and we allow this to open healing, secondary intention healing. In these areas, this is very beneficial. I use it every day because it will help me to get the best results and this to heal very fast. So how we do this, and I will show you cases that they will explain to you exactly the biology of this soft tissue healing in the mouth and how we help it with a Blue-M gel. So we do two big extractions. We place a bone graft, some collagen, we place stitches. So this is a normal socket plug technique. And what is happening is that after a few days, first we have the development of the fibrin network. So what we see here is that we have fibronectin, that it is covering the bone graft. This is just after a few days. What is the next step? The next step is that we have collagen. So you see here that the bone graft and this fibrin network now is covered with granulation tissue, and it's the fibroblasts. So from all around the area, the fibroblasts are the cells that are creating this connective tissue. And when the connective tissue is ready, we have here the new epithelium. So the new epithelium from the periphery is covering the connective tissue, and it is the keratinocytes now from the soft tissues that are creating this epithelium. So this is how it heals. Inside, we have new bone formation. Outside, we have the new soft tissues. And the cells that are responsible for the new soft tissues are the fibroblasts and the keratinocytes. If we look this closer, in this study, we took pictures of the soft tissue healing almost every day. Same scenario. On the top left, you can see that I did an extraction. I placed a bone graft, collagen, and a few stitches. So the white numbers, they represent the postoperative day. So you can see that after 2, 3, 4 days, the bone graft is in place. The area is clean. We don't have any infection. And what's happening at the beginning is we have this fibrin network. Here we can see it better. So everything is stable. And at the beginning, we have fibrin all inside the bone graft and over the bone graft. After a few days, as we can see clearly here, we have from the fibroblasts, the connective tissue, the granulation tissue that is covering this fibrin network. And in this case, after 25, 26 days, we can so nicely see, you see here from the periphery, as an aperture, we have new layers of epithelium. So you see the epithelium from the periphery, it's growing, and it is covering this collagen. So day by day, it is proliferating. You see here I have more epithelium, even more. It's closing, and you see now I have a small area of connective tissue. All this is new epithelium. It's closing like a ring, and at the end, as you can see here, we just have new keratinized epithelium that has covered the area. So that's the biology. Again, fibroblasts and keratinocytes to give me the soft tissue healing. And this is why we apply every day, 3 times a day, the gel, as long as this takes place, because the gel will release the oxygen, the gel will release the lactoferrin. We will send oxygen and lactoferrin to the fibroblasts and the keratinocytes. At the same time, we will keep away the pathogenic bacteria, and this makes all the sense, give us all the tools we need to have excellent soft tissue healing. And we have also scientific papers, we have experimental research from our group, and we saw exactly all this that I just showed to you, how it happens in the mouth. Experimentally, we analyze in surgical wounds in animal models, how in detail this is happening, and how Blue-M gel, the oxygen, the lactoferrin, they help all this healing of the wounds. So it looks like a detail, but we need to focus on all the details of the treatment we are doing, because in the details lies good work, and like everything, we need to see all the fundamentals, and the bacteria, the soft tissue healing is one of the fundamentals in all the treatments we are doing in dentistry. And if you have read this book from Robin Sharma, it's so important to have consistency in all the things in life. So that's what I'm trying to do. I'm trying to have these oxygen treatments, the treatment with Blue M, as an integral part of my protocols, whatever I'm doing in dentistry, in oral surgery, because it keeps the bacteria under control and it is accelerating consistently the healing. So I will show you a case with implants, and again, like prosthetics, like root canal treatments, like everything else, implants, we have to see them as a system. So when we do implants, when we do the surgery or the restoration, or if we do all the treatment, we need to understand that it's not just the implant. We are talking about a biological, a complex system, and which are the parts of the system? The hard tissues, the bone, the mechanical components, and the soft tissues and the bacteria. It is a system. We place a mechanical fixture, the implant, which has a specific surface. We have abutments, we have final restorations, we have cover screws, we have the bone, we have the soft tissues, and we need excellent, healthy, thick, keratinized soft tissues, not only for aesthetics, but because most importantly, the soft tissues will create the soft tissue barrier, the soft tissue seal around the prosthetics, and this soft tissue seal is going to protect forever the implants. And we have a part of the system which is the bacteria. As we discussed earlier, we have everywhere biofilm. You see here bacteria and biofilm on the healing abutment, on the surface of the stitches. And this important element, this fundamental part of the system, the bacteria, we need to address it and we need to see it clearly as part of the system to prevent problems and to have much, much better results. So let's say only about implants. The elements are grounded in clinical aspects, biology, and biomechanics. If we want to be a good implantologist, we need to understand all the elements of the implant system. So what we need to learn? We need to know 3D implant positioning. It's extremely important. The interfaces, how the abutment fits with the implant platform. The other parts of this system are the hard tissues, the soft tissues, the material surfaces, what materials we are using for the implant surface, what materials we are using for the abutments and the final prosthesis. And last but not least, again and again, the bacteria. We cannot forget them. We cannot eliminate, remove, or replace any of these parts because they are interdependent, they are interconnected, and they are interacting. That means that if I have a problem with the materials or with the hard tissues or with the positioning or with the bacteria, everything as a domino is going to affect the system. So if we cannot control the bacteria, if we cannot help optimize the healing, then as a system, as a domino, that is going to give us problems with the soft tissues, the hard tissues, and the long-term success of the implant. So we need protocols. All my treatments are based on well-defined, solid protocols, and that is making me, I have less need to take decisions. So I just follow my steps. Everything is standardized. And a big part of my standardization is the use of Blue M gel. Let's see a case. In this case, I had to remove this tooth. And as you can see in my digital workflow, I'm planning to place an immediate implant. So I leave nothing to luck. I need to precisely have a workflow. I need to design all the parts of the treatment because we need the map. We need to know exactly how we will remove the tooth, what implant we will place, what bone graft, how we will do all this, and also we need to design in advance the final prosthesis. So you see here that I use my digital workflow to plan the surgery. I see the tooth, the bone, where I will place the implant, what kind of implant, what diameter, what length, which position will be the best for the prosthetics. So we need to design to see everything in advance. And now we are ready to execute our treatment. Again, the first skill is to remove the tooth as minimally invasive as possible, because we must not damage the thin buccal plate, we must not damage the soft tissues. And then, as we stated before, we need to clean the bone. It's fundamental. We need to go all the way inside the socket with the light. We need to see if there is any soft tissue left around the bone. We need to take our bone curettes, our degranulation burrs, and make all this area very, very clean. We need to have only clean bone. And when we have this and we rinse the area, I apply the gel for 5 minutes inside the soft tissues and inside the hard tissues. So I let the gel for 5 minutes to release oxygen and lactoferrin. We need always guidance. That's why for the implant cases, it's so important to have surgical guides. So in this case, I will use the guide to drive my implant at the correct positioning, because if the positioning of the implant is bad, is wrong, then all the other steps will have problems. So we can see here the placement of the implant. Very important to use our guides, to use our digital workflows to do the best placement of the implant, in which specific 3D positioning, in what depth we are going to place the implant, but of course all these are topics of other big discussions. And here, after placing the implant, again, before doing my abutment, because I will need 5 minutes, again, I'm not leaving it like that. I'm placing a tiny amount of gel, a dual zone placement of the gel to help the hard tissues and the soft tissues to moisturize them and to release some oxygen and lactoferrin. Now I have my bone graft ready. I remove the gel. I do my dual zone grafting. Here I use the silicate beta TCP. I used Powerbone in this case. So you see, everything is clean, everything is grafted. And now what I'm using extensively, and I suggest to all of you to learn and use customized anatomical healing abutments like this one here. So you see how nicely the abutment is attached to the implant. And because it's an anatomical abutment, it's perfectly sealing the area. It's protecting the bone graft, but most importantly, it's going to help the soft tissues to stay there and to heal in the perfect way. What you can see here is that when I apply any abutment, I just place a small amount here of gel and then I apply it. And in many cases, also because I want to keep the bacteria away, sometimes I'm sealing the margins of the wound with periacryl, with tissue adhesive, because we need to do whatever we can to keep bacteria away. So I use my tissue adhesive and the part of my protocols, the gel, immediately post-op, and the patient will get the rest of the gel to apply it 3 times a day. So this is how we ensure that we'll get the best results. We need planning, we need digital workflows before we do anything. We need good extractions. We need to clean the soft tissues and, most importantly, the bone, perfect debridement of the hard tissues. And then we need to disinfect it with our gel, use our bone grafts, our implants, our anatomical abutments, and after that, to use the gel every day for as many days as we need. And at the end, we're going to get the optimal result. So this is the final result in this everyday case, following standardized protocols, ideas, we can get very good results with consistency. So a detail, but an important detail, is that whenever I place an anatomical abutment, or whenever I place a stock healing abutment, or a normal healing abutment, or even a cover screw, always I place a small amount of Blue M gel. And I do this because when we detach and we reattach any prosthetic component, firstly, some bacteria, they enter the platform of the implant. We remove it, so some saliva will get in there. And also, when we remove the abutment, the soft tissues are detached from the abutment. That's why they bleed. So every time I remove it, I fit it back, I remove it. Every time I produce a small soft tissue dehiscence, a small soft tissue trauma. That's why they suggest that we need to detach and reattach the components as few times as possible. So I place the gel because it will help the soft tissues to recover and to heal really fast. On the contrary, we must not use chlorhexidine, because if you use here chlorhexidine, as we said, it might be toxic, so it might damage these delicate cells. And also chlorhexidine, as we know from research, because it's a bit toxic, it might not allow the cells quickly to reattach to the prosthetic components. So for this reason, my suggestion is whenever you place your healing abutment or your provisional or your final restoration, take a small amount of the gel and apply it around the screw, the prosthetic screw. And because the gel, the Blue M gel, doesn't have any oils inside, you will not have any problems with screw loosening. So it's very effective and very safe to do it the way I'm doing it. So it's many small details, but if we learn all the elements of what we are doing, if we learn the big and the small secrets, then we'll do very good work. In any kind of procedure, let's say if you do soft tissue grafting and you harvest from the palate the connective tissue, your grafts, this is very helpful. You apply the gel, you give it to the patient, you have less inflammation, less swelling, less bleeding, less pain. So if you leave it like that, or even if you make a protective palatal stent to cover the palate after the surgery, always give a gel to the patient, a small amount, it will help these sensitive soft tissues to heal much faster. In any type of surgery, like here that I did again a palatal surgery to uncover this impacted canine. Again, during the surgery for 5 minutes, as you can see here, I apply in the hard and the soft tissues the gel. I place my stitches, and because it's going to be very difficult the first days for the patient to brush it, we'll give a very soft toothbrush, but this will do all the work. It will help the patient to have less pain, less inflammation, will control the bacteria, less possibility for post-op infection, and most importantly, this oxygen and lactoferrin, they will go inside the soft tissues and they will optimize, they will accelerate the soft tissue healing. This is the rationale. It can give me solutions. It can help me to optimize the healing in whatever I'm doing. When I remove impacted wisdom teeth, again, we have bacteria. The bacteria, they do pericoronitis. We can have an inflammatory cyst, or we can have a developmental cyst that might get then infected. So again, we remove the wisdom teeth. We have to be very careful with the surgery. So as you can see, we need to remove the tooth as less traumatically as possible. And now, because all this area has millions of bacteria, we need to disinfect it. So I'm doing the same. Again, in the surgical defect, the gel for 5 minutes, I remove it, then I can place my collagen or whatever else, maybe I can place some bone graft if needed. Stitches, and this is very important, pressure on the wound, but before applying my gauze, I apply some gel here to keep the stitches clean and to accelerate the healing of the area. This is the goal, because when we do wisdom teeth surgery, what we need in the long term to avoid any perio problems behind the 7. Because many times, because it might get infected, because the healing might not be that good, we might have bacteria, we might not clean it correctly. What is happening is that we see the patient after a year, after 6 months, after 2 years, and still we have deep pockets behind the 7. So in order, like here, not to have pocket, to have just 1, 2, or 3 millimeters of pocketing and no bleeding, we need the optimal healing. And the optimal healing, we'll get it with a good surgery by cleaning mechanically everything and by helping the soft tissues to heal faster and controlling the bacteria. This is the whole logic of why I'm doing this consistently. Now, if you do hygiene, if you do perio cases, if you do prosthetics, like here we have some old restorations and constantly it's irritated, it's bleeding, we need to help it. And in order to help it, we can also rinse it or place the gel. Here, as you can see, I'm rinsing it with Blue M solution. You see immediately how it's releasing deep inside the pockets all the beneficial ingredients, the oxygen and the lactoferrin mainly. And then when the patients, they complain that it's bleeding, it's smelling, the gums are always red, swollen, irritated, what I'm doing is I'm giving them the gel and I'm telling them just use a small amount of the gel with your interdental brush and then send the gel with the brush inside the red swollen soft tissues, and this is helping a lot. And we get the feedback. This is the amazing. The patients, they are coming back after a week and they say that I used it immediately. It felt very good. They ask for more and they can continue using it for as long as possible. Because as I told you, it has only benefits, 0 side effects. Now, most of my patients, they grind, so they have night guards, or they have Essex aligners, retainers, Invisalign. So they have appliances that they collect bacteria. So what I'm doing is I give them or the Blue M foam or the gel. So as you can see here, inside the night guard, inside the retainer, especially when I have done a surgery in their mouth, I give them the oxygen and lactoferrin, the foam, or they apply the gel, and that's how they use it in the mouth to keep everything clean. And it feels much better. Now, for the long-term maintenance, they can use, instead of using chlorhexidine, and that is going to damage in the long term the normal bacteria, they can use such elements. They can use the foam every day if they want. They can use the solution, or around my implant crown here, they use the most important, the interdental brush. But if something gets a bit swollen, if something starts bleeding, they can use a small amount of the gel. In this way, it's so easy and so effective. There are also excellent clinical studies in periodontology, if you are doing periodontics, where we see that the application of the Blue M gel inside the pockets, especially in patients that have also systematic conditions, can significantly improve the healing. These are cases from my colleague, Tatiana de Liberador. She's professor in Brazil, and she's doing mainly periodontics. And we have published a lot how the Blue-M gel can be an adjunct, something that can help all the conservative or the surgical periodontal treatments. So it's something that you can learn about, you can consider it whenever you are treating perio patients. And of course, we have knowledge, we have evidence, we have clinical applications in many other treatments. Let's say there are some papers published with clinical studies how Blue-M gel, as you can see here in this publication, can be very helpful for osteonecrosis of the jaws. So there are many advantages. There are no complications, no disadvantages. We are using oxygen, we are using lactoferrin that controls only the bad, the pathogenic bacteria. It doesn't affect the normal flora, that we need the normal flora in our mouth and in our gut. And at the same time, it is accelerating the soft tissue healing. So it's a part of the basics. To control the bacteria is a part of the basics. We need to know the fundamentals, the basics, because all these fundamental elements constitute the vocabulary that we will need to find our own voice. So you don't need to do exactly what I'm doing. You need to have your ideas, your way of working, your protocols, but having your philosophy, how perfectly you will control the bacteria, how you will accelerate the healing, because it is an interconnected, very important part of any treatment. So as a conclusion, I try to explain to you why I'm using Blue-M, how it works, how it's releasing oxygen and lactoferrin, how this affects and controls only the pathogenic bacteria. We can use it before the treatments, we can use it during the surgery, immediately post-op, during the first phases of healing, so the patient can use it at home, and in the long term, for any time in the future they will need it. It's safe to use it even every day. So thank you very much for attending today. Whatever you need, you can ask me, you can send me an email, you can follow us on Facebook. This is my personal Facebook page where I post scientifically all my cases, many of my cases. You can find us on Facebook, and hopefully you will join us to our Blue-M community. Thank you very much.
Thanks a lot, Minas, for a brilliant presentation. We have quite a few questions lined up for you. So if you hang around, Nishant will be passing on the questions and he will be sending you the questions and you can answer. And I will interject in between if there is something necessary.
So good evening. First of all, thank you so much for a wonderful deliberation. I mean, the crowd is still awestruck and I'm just waiting. I mean, they're trying to sink in with the content. Then basically, we have some questions which have started coming in. I will read out those questions. So the first question, will you like to comment on this? That can we replace Hezidine in all places in dentistry?
It can replace, in my work, it has replaced the last 10 years Chlorhexidine in all my everyday cases. Where I think it's important to use something so strong like Chlorhexidine is when we have immunocompromised patients, when we have very difficult bad infections, abscesses in the mouth. So for a very short period of time, we need to send in the mouth something very strong, something that will kill as many bacteria as possible. So I have limited a lot the use of Chlorhexidine when I don't have immunocompromised patients. When I don't have active bad infections in the mouth, I never use Chlorhexidine. Instead, I'm using Blue-M gel. Now, because we give antibiotics many times when we place implants, and we know that antibiotics, they have a very bad effect on the gut bacteria. So this is another reason why we should try to limit, to avoid to use on top of the antibiotics, something like chlorhexidine that in the long term might also affect the normal bacteria. So as a conclusion, whenever I have a healthy patient, not immunocompromised, and I don't have any active bad infection in the mouth, I'm not using chlorhexidine.
So the second question, I think it's related to the process. So the doctor wants to know that can this process be also done with the help of lasers? I mean, I don't know, so that was a part of question, so probably you can address that, sir.
It can be used as an adjunct to any type of treatment. The laser will not interact with the gel. Doesn't mean, let's say, that the laser will activate the gel more. No. But if my colleague is using the laser for his treatments, we can send him also papers that in synergy with the laser, he can use the Blue-M gel to get even better results. But the release of oxygen and lactoferrin is activated spontaneously when the gel comes in contact with blood or saliva. So it will not be more activated by the gel.
So there's a question in India, we use a product called Metrogel. So the doctor wants to know, is Metrogel good for cleaning the socket after extraction?
I don't know the specific product. I don't know what's the...
Minas, it is metronidazole.
Okay. Yes, there are protocols that they use gels or antibiotic solution to rinse the sockets. They can use it just for a few minutes, just to apply it in the socket. It can help.
Okay, sir.
There are many clinicians who are using topically a gel or a solution of antibiotic inside the sockets. I have done it in the past, but it's something that you use it just in the socket.
But Minas, they wanted to know, can it be used in place of Blue-M gel?
I would say that it's much safer and effective to use the Blue-M gel.
Okay, thank you.
It's not antibiotics, so it's safer.
So
they can leave the Blue-M gel as much time they want in the socket before removing it. It's working consistently, and then they use the gel when they finish the surgery on top of the socket, and the patient can use it as long as needed. Something that they cannot do it with the gel of metronidazole. So I have stopped. In the past, I knew this protocol. Sometimes I had a solution of antibiotic rinsing my sockets, but since I understood what I'm doing with Blue-M gel, I have stopped and I have focused only on my protocol.
So the next question wants to know, I mean, applying the gel for 5 minutes has full effect on the socket? Or what are your comments on this, sir?
It's not something that measurable. It's not something that we can see with our eyes, the defect. The logic is we apply the gel inside the socket. So first inside a clean socket. So we need to clean the socket perfectly from the soft tissues. We need to make it with a suction to remove the blood, and then I apply the gel. So the oxygen, even for 5 minutes, will remove a bit of necrotic tissues of necrotic bacteria. Even for 5 minutes, it will penetrate the bone to remove more bacteria that can be inside the bone. The lactoferrin, the same, because we know that the lactoferrin has a big advantage on the hard tissues also. Even for 5 minutes, I want to send lactoferrin into the bone So we have some benefits. It's hydrating the bone for 5 minutes. We don't have any strong proof, any study showing exactly that if you place it in the socket, you have a statistically significant benefit. But with because I know how it works, I know how it does, what it is releasing, what's happening in the socket. So I believe that it will have only benefits to apply it for 5 minutes in the socket, and we are not using something that can trigger allergic reaction, something that has antibiotic, something that has chlorhexidine that can be toxic. So we apply something for 5 minutes that can only help.
So thank you so much. I think we have been deliberating for the last 1 hour. So if you permit, I'll take one more question. So this question says that, do we place Bloom gel every time you reattach any attachment to the implant fixture? What are your thoughts on this, sir?
Yes. Every time I have an implant case, so I will do any procedure that involves fitting on the implant of healing abutment, or an impression post, or a temporary abutment, or the temporary crown, or a final crown. So when I have such a case, my nurse knows that before I start, where I have my clean drapes, she's placing aside, next to my instruments, a very, very small amount of Blue M gel. So when I will remove the cover screw, or when I will remove the healing abutment, let's say to take my impression, I clean the abutment very well. If you have a steamer, it's an excellent idea to steam the abutment. And before I fit it back, I place this tiny amount of Blue M gel all over the abutment, and that's how I fit it onto the implant. So as many times I will detach and reattach a prosthetic component, I clean the component very well, and before fitting it onto the implant platform, a very, very small amount of Blue M gel. I do it in all my cases. You don't need to use a whole syringe, just a tiny amount.
Thank you, sir. Thank you so much for that detailed explanation. Now, this question will probably must be there in a lot of doctors' mind. It has come that are there any contraindication for the use of Blue M gel? So, from the safety point of view, any comments on that, sir?
More than 15 years that we use it. Personally, I use it consistently, 10 years. We work with Blue M and we get consultancy with experts all over the world, and there are also thousands of clinicians using everyday Blue M gel. We never had one problem, one allergic reaction, one cytotoxicity reaction, ever. So it's absolutely safe. It's absolutely safe.
So thank you. I think that response would have given the right answer to a lot of people who would have thinking that probably if there are anything that should be aware of. So there are multiple questions on the similar pattern that has already been asked. So with your kind permission, I'd like to kind of thank you, sir, for kind of joining us from so far and deliberating on a subject that was relatively very, very new for the Indian audience, and for India as well as for the Nepal audience. As always, sir, it was wonderful listening to you. And I'm sure, sir, that the crowd today was immensely benefited by your deliberation on Blue M gel, sir. So thank you so much, sir. And I leave Dr. Kakar to give a word of thanks, sir.
Thank you so much, Minas, for a lovely presentation and a lovely overview of Blue M gel. It was just perfect for the webinar. It was just what I wanted. Thank you so much.
Thank you, my friend. Thank you very much. It was a pleasure, an honor for me. Thank you for inviting me. I hope it was, I gave some ideas.
Yes.
The colleagues can find everywhere they want. They can go on PubMed. Most of the papers are open access. They can go on the Blue M website to find the papers, and they can follow us on social media. Thank you very much.
Thank you.
Thank you, sir. Good night to you.
Thank you.